Hello and good afternoon, everyone. In the start of this month, on 2nd of April, we brought to you a exclusive COVID Chronicle with Dr. Anirban Dalui. He gave us an update on COVID-19 through a doctor's lens. The webinar was a huge success and with an overwhelming response and questions from our audiences. So you ask and we deliver yet again. COVID Chronicle, Episode 2, an exclusive session with Dr. Anirban, who will answer all your questions today. So Dr. Anirban, over to you.
Let me start with the first question with Dr. Vikas Dhikav. He asks that with several new strains emerging, what is your take on vaccine effectiveness? Let me tell you first what is vaccine efficacy and effectiveness, the different terms. Why should we coin these two separate? The efficacy is the scientific one term which gives us the protection or the how the vaccine is effective on an individual level, and efficacy that is efficacy, and that is effectiveness is the how the vaccine is effective throughout the community. So if I ask the basic things, that efficacy means does it work at all, and effectiveness says that can it be applied, can you carry the efficacy to the people at a large. So if I consider the efficacy of the vaccine right now, whichever applicable in India, likely first one is Covaxin and Covishield. So it shows by the phase 3 trial that efficacy of the Covaxin is around 81% and efficacy of Covishield is around 60 to 70%. So it is quite good efficacious, but effectiveness we'd like to wait for another 2 to 3 months at least, so that we can have the data on how effective it is throughout the society. But if I consider the previous vaccinology, previous data on vaccines and everything, so we should be very much hopeful about the quite good effectiveness of the virus of the vaccine. So I hope that this Covaxin and Covishield will be effective one in our population also. And the larger the people will vaccinate, will get the vaccine, the more is the effectiveness, the more population will be under cover of the vaccine and herd immunity will be developed. So after having this kind of herd immunity or protection for all the or majority of the population, we will have this, we can say that vaccine is quite effective. So we have to wait, and we have to wait for the interim data analysis, and we'll get the result after that. But we are hopeful, and we are actually hopeful about the result of the vaccine. So next question arises, Dr. Priya Ganesh Kumar. She says, I am a case of pulmonary embolism on anticoagulation medication drug rivaroxaban, and can I take the COVID vaccine? So just let me clarify your issues in the patient. The patients who are taking aspirin group of drugs, which is known as antiplatelet as a whole, they can take the vaccine without any precaution. They should not stop the drug and should take the vaccine whenever their name has been registered, whenever the situation comes. In case of another group, that is anticoagulant, it includes warfarin or warfarin group of drugs or NOACs, newer anticoagulants. So these kinds of drugs, you have to check you have to check the INR. If the INR is around 2 to 3, you can have the vaccine, and you should not stop the dose your medicine at all. And practical way, as I have been in charge of many vaccination sessions throughout our state. I just saw that there are no such problem, no such side effects or adverse effects on the patients who are taking the warfarin or NOACs regularly. We just press the injection site for more than 2 to 3 minutes, so that no hematoma formation will occur, and that is enough, I guess. From my practical experience, I'm just suggesting you to take the drug and check your INR, and if it is okay, just go and get your vaccine as early as possible. The third question from Dr. Lula, Nirmala Lula. Please let us know when to vaccinate yourself after you had the COVID infection. This is a very important question. The first question I want to just add to this that some people ask us if I've already have had our COVID within last few months. So should I take the vaccine? There is any need to get vaccination? So my first answer will be yes, because after having the COVID, there is no guarantee or surety of having good immune response in your body. And after having COVID, you will get your immunity, your IG, G, and as well as the other T's memory cell. They all should work well, so that the antibody should last longer. But if you have the immune system not so good or well acquainted, so that time you have to take the vaccine. So don't depend upon the COVID situation, the COVID, whether you have had COVID or not. Just go and vaccinate first. And the second question, if I have had the COVID within last few months, or if we already have COVID, so if I want to take vaccine, what should be the ideal gap or ideal time gap? So according to the ICMR or national guideline or CDC, it should be 4 weeks after the cure, after the completion of the disease. That is, if you tested positive from day 0, and you have to get home isolation, you have to be at home isolation for 17 days, and after 17 days you have to wait for 28 days more, and then you have to take your vaccine. So this is the guideline, and you have to go through this. So Dr. Lava Bhaskar asked that Covishield or Covaxin till today, which has less severe side effects? A good question, but very controversial one. I am not going to support any vaccine right now, because this is not a policy from government point of view, from a physician's point of view. But I must say that if we consider the making of these two vaccines, the way they have been marketed, the Covaxin is a killed viral vaccine, and the Covishield is a viral vector vaccine, which is a more newer technology. It is very within 5 to 10 years back, this kind of technology has been invented. But the Covaxin, the way it has been produced, is very age-old procedure. And as we know, if I consider the other vaccines and other vaccinology in other sense, we have seen that the field vaccine has less side effects than the live vaccine or like this vector virus vaccine. But if I consider whatever the practical situation now, whatever the situation prevailing in the society, then we have to wait, because there is no definite data on that Covaxin is bad or Covaxin is good, or Covishield is having more side effects than Covaxin. We have no such data to comply or to conclude on that. But it is better to say that if we have the killed viral vaccine, then it is expected that the side effects are less. But it is not that important for us, because in both the vaccines, the documented cases of AEFI, that is the adverse effects following immunization, these are very minimal, and whatever we have expected, it is less than that also. So don't be so anxious on that. just take your vaccine, whichever available. And I must say that the people of people above age of 65 or 70 years, they should go for Covaxin because it has good immune response and comparatively it is safer if I consider the nature of the virus. The next question, Professor Pranab Kumar Mukherjee has asked that what is reinfection with COVID-19 after vaccination? Will Covishield vaccine protect SS strain, South African strain? How many reinfection cases have been detected in India after Covaxin or Covishield recipient with 2 doses? Sir, first of all, your question, what is the reinfection of COVID-19 after vaccination? I have already mentioned in our last in conversation that there is a Pillsman effect which is prevalent in like now in the society, that people thinks that after having vaccination they feel that they are protected and they just forget to maintain the COVID protocol, COVID appropriate behavior, and that is becoming problematic for the person, that is becoming the virulent, then the viral form has attacked the person. But as far as if I can consider the cases, I consider the literature, there is the vaccine, uh, the after having the full 2 doses of vaccination and after 4 weeks there will be a good number of T cell or B cell responses as well as immune responses in quite good number of people. But as already I have said that there is these 2 vaccines are not, or any vaccine in the world at any time are not 100% efficacious. So there is always a chance to have COVID after getting vaccination. The exact data whichever which are lacking right now, we are lacking right now, but it is definite that if we uh, strictly follow the COVID appropriate behavior after even after vaccination, that will help us to get rid of COVID. And as well as I must ensure you that after having this vaccination and after 4 weeks, even you have the COVID-19 infection, that will be a milder form. It is already evident from our different resources. But the exact number of second infection or reinfection, we don't have the data right now. But some literature, some small literature on studies on small subjects, they are saying that 0.69% is the chance of having reinfection, but which is not clearly mentioned or clearly adopted in case of whole population. But in few cohort study, in few cohorts, we have seen this kind of information. We can have the reference with that, but we are not very sure on that. But it is the situation. It is the this kind of this 0.69% of infection or chance of having second infection is just giving us the hope that after having vaccination and after having these 2 doses and after 4 weeks, people will the chance of having infection is very less at this 0.69%, that is 69 per thousand. And if I consider with the COVID appropriate behavior, the chance will be more less. So, and your second question, how many will Covishield vaccine protect against SS strain, South African strain? It is very controversial question and as well as very important one. If I say, because if you follow my lecture, that I have already mentioned, there is South African strain is very few in number in India. If I consider the whole genome sequencing of total genome sequencing in India, so and there is no definite data on that Covishield is not effective or effective against the South African strain. But it is quite obvious. We are just getting the details. We are just, if we consider retrospectively, so we're seeing that this Covishield is giving not giving protection against the whole of the variant, as it is a and is a product of viral vector. It is a product of viral vector vaccine. So it is not expected that it will give your immunity all kinds of against all kind of mutation in COVID-19 virus. Rather, the whole virus vaccine like Covaxin, these vaccines are we expect that these type of vaccines will give you more immunity against all kinds of mutation in the whole virus or variant. So it is our just hypothesis. There are no foolproof result and no foolproof data also. So just according to our hypothesis, just we are giving this suggestion. And if we consider that in our state, in our country, the South African strain is very less in number and very much, though it is very much virulent also. So we have to be very cautious. The genome sequence should be, we should wait for the more genome sequence. But in cases of Indian mutation, whichever we are having, that Pune strain or Amravati, or that is the scientific names are there. I am not going to utter these names here. But these mutations should be quite helpful if we this infection, these strains will not be that effective if we have the Covishield or Covaxin, because they are getting the vaccines on the S protein. So these changes are having made in the S protein also. So as a whole, they are give you the whole immunity. But the South African strain, or if we get the further in future, this further mutation, virulent mutation, we are not so hopeful. We don't have any data because we don't have any data. And COVID is an emerging disease. Every day we are learning from it. So we have to wait. Maybe we have to take another booster dose, or we have to take 6 monthly or 12 monthly every year. So we don't have any data. We don't have any prediction. But if I consider the science, if I consider our previous experiences, we must say that right now Covishield and Covaxin can be should be well protective against the Indian virus and their mutations. So the next question from Dr. Vijay Kumar Bansal: are vaccines the solution for controlling COVID-19? Sir, this is a very good question, and this is a very commonly uttered question from the population also, general population also. So let me say you one thing first, that vaccine is the only hope right now, because we are just giving priority on vaccination, as we know this virus can be fatal. This virus can stay for 3 to 4 years more. But we want the herd immunity against it. If we achieve the herd immunity, then we have the protection against this virus. And after if we have the protection, then after 2 to 3 years, the virus will itself loses its power, loses its virulence, and it will go off. But we have to create the herd immunity. So right now, if we consider the ways to have the herd immunity, there are two main ways. One is we are getting the herd immunity through natural infection, which is not very possible and not that practical in a country like India, where there is a more population size, the dense population size, etc. So we must consider on passive immunization or passive way to create the herd immunity, and this will be helped by the vaccination, COVID vaccine. If I consider the COVID vaccines, they are safe. Already they are mentioned in phase 2 trial, and they are published in big literatures. And if I consider the phase 3 trial, they are quite efficacious according to their data, like they are 60 to 70% in cases of Covishield and 80% in Covaxin. No vaccine in world is 100% efficacious. This cannot be done, cannot be possible. So vaccine, we should take the vaccine. The vaccine should help you to remove the chance to decrease the chance of having severe COVID or the COVID for which you are getting admitted in the hospitals or like that. And as well as there are few vaccines we are working, the scientists are working on few vaccines, and they're trying to prove that the vaccines also help you to reduce the transmission also. So the Covaxin and Covishield will not guarantee on the transmission, but it guarantees you that you will have, if you have the reinfection, if you have the infection even after vaccination, it will give you it will give you the assurance of having minor disease or mild disease or mildly symptomatic. So majorly it is depicted and it is the truth. So vaccination is the right now the only way to get over the COVID-19, and not only vaccination, we have to follow the COVID appropriate behavior along with the vaccination. Otherwise, the whole vaccination procedure will go in vain, because all these vaccines are not 100% efficacious. So that if we leave any chance, if we leave anyone who is capable of having infection, like if I gave 100 people of COVID vaccine, and 80 of people will get the immunity and 20 will not get the immunity, and they are still very eligible to have the or liable to have the infection, the COVID infection, and they will have the power or capability to transmit the disease. So to check this spread, to check this transformation from mild to severe disease, we have to rely on the vaccines. This is the epidemiology, and we have to trust on this. So the next question from Preeti Shankar: someone who has completed the course of Covishield, when can he or she can take Covaxin? This is a question of doubt, because right now the policy from national level, but not the central government or the state government, there is no chance of having two vaccines one after another. If you get the Covaxin, you will not be eligible for any other vaccine like Covishield, or any other vaccine will come, Covavax or Sputnik or Moderna, etc., which will come in later in the Indian market. Who knows? But this is a fact right now, that if you have the one kind of vaccine, you will not eligible for further. But if I consider that if you ask me that if we are getting one vaccination, the full course of 2 doses, so after how many days we should take the booster dose or same vaccine or the other vaccine? So this is not the time to say. But if we find the literature, if we cite the literature, then it can be said that we must have the booster dose on yearly basis, as like the flu shot, like influenza vaccine, or maybe less than or more than that. But the booster may be needed, and according to my knowledge, according to my experience or my theory, the booster dose should be required at a definite interval of time, and I think within the end of this year, the proper guideline will come and directive according to them. So the next question from Sanju P. Joy, Dr. Sanjay Joy: when will vaccinating adults aged 40 and above will start? So this is also a programmatic or policy making questions from the policymakers, questions towards the policymakers. Till now, we have to consider what is the vaccination strategy of India. The first of all, government or the policymakers want to vaccinate the high risk group. Who are the high risk? Those who are working with the COVID patients or COVID wards, like the doctors, nurses, the healthcare workers. So they should get the vaccine on the priority basis. Then the frontline workers like police, like Jawans, like your municipal workers, like that. And after that, above 60 years old, and therefore above 45 years old, with or without comorbidity. So these will be our priority group. If this priority group has been well vaccinated, or a good number of people are getting the after having this vaccine, then the government will shift to the next age group. And if we consider the what is the time when it will be available, I must say that this population, the above 45 or above 60 population, the government has already taken into account that it is around 30 crores minimum. As a minimum, 30 crores population will get the vaccines. If I consider right now the age group, whichever age group is considered, age group is considered right now. So these 30 crores we will get at least more 3 months or 4 months. So after that, the vaccines can be available to the market. You can buy, or the government will give the vaccines at a lower cost, or the government will give you the at free of cost. But the policy will be decided later on, considering the case scenario, considering the total COVID load, and considering the storage, or considering the supply of the vaccines. So wait for that. And till now, you have to maintain the COVID appropriate behavior without without fail. So the next question from Dr. Pawar, Madhuri Rathod Pawar: can COVID vaccine be given to 20-year-old patient with severe food allergy history? So there is two portion in this question. One is, can we give a vaccine to 20-year-old people? Yes, if we consider theoretically, because the data, whatever we have whatever available in the literature, that it gives a complete data, complete facts on the scenario that 20% on the 20, the people above aged 18 years, they can get the vaccines. But if I consider the policy right now, it is not possible to vaccinate the people over age of 20 years or below 45 years, better to say. So we have to wait further for people below 45 years to vaccinate them, to get the vaccination. And the second part of the question, if you have the allergy, on the food allergy, should I take the vaccine? So I have to clarify this doubt that allergy is a very vague term. There are the listeners, today's delegates who are listening to me, almost all of you know that allergy is not a single specific term for any issues. Allergy may be due to some kind of food, due to some kind of contact surfaces, due to some kind of drug, due to some kind of environmental changes, and the responses will be different. So there is a huge response. There is a huge types. There is a different types of the response, like range of the response, like someone having just cough, someone having some rashes on their body, someone is having choking sensation, and someone is having severe anaphylactic reaction for which he or she got admission into the hospital, and then they was treated. So considering the facts, if I consider the practical experience also, I must say that if we have allergy, as far as I know, you all will agree that every one of us has experienced at any time of our life about any kind of allergic reaction. So if I consider allergy is a significant contraindication, then no people can be vaccinated on that basis. So there is any definite history of anaphylaxis for which he has been admitted for the hospital, or treated in a hospital, and treated in a ICU or like that. And if the doctor considers that these anaphylactic reactions is not only single time, that is repeated time anaphylactic reactions are there, and also if the components of the if you have the allergy to the components of the vaccine, then you should not take the vaccine, or you have to consult your physician at that time. Otherwise, the normal allergy like food allergy, like any kind of dust allergy or any uh, contact allergy, you should go for the vaccine. There is no such absolute contraindication for these basic minor allergy reactions. Next question from Suhashini Vasi Reddy. How long do you have to suspect the second wave? Dr. Reddy, we have already experienced the second wave. Just I have mentioned in my last discussion that in Maharashtra, Punjab, the 6 states, they are already having the response, having this, they're getting the experience of second wave. And in India, the vast country like India, where the population is so vast, so densely populated states in some kinds of Maharashtra, from Maharashtra to Delhi, from West Bengal to Tamil Nadu. So everyone, the specific infrastructure that depends, the second wave will depend on the infrastructure, depend on the how the government or the local authorities will take measures, how the people is reacting to the COVID situation. So on depending on everything, that state or the places will experience the second wave, and then if I consider the Maharashtra, Punjab, Karnataka, Delhi, Kerala, they're all having the second wave, and they're on the peak. The peak is again rising. The peak is very steep. That their rising trend, and the doubling time is very less. And if I consider the previous years data, there's this time the doubling rate has been reduced to half, and it is very much problematic, very much alarming. And if I consider the other parts of the country, they are also taking the peak, also taking the rapid increase in numbers day by day. So the whole country as a whole will not experience the second wave as a whole at the same day, but is a phasic manner from one corner to another corner. Every part of the country will experience the second wave if unless we are not taking the COVID precautions, not taking the COVID appropriate behavior seriously, or the authorities will not take, if authorities will not take the proper measurement at time. And the last question, next question, Dr. Dhruvo Bhattacharya, is it advisable to administer COVID vaccine to relapsing remitting multiple sclerosis patient not on any drug? So, to be precise, this multiple sclerosis patient should take the vaccine if he or she is not any kind of medicine. Also in cases of the patients who are having any kind of immune, this is any drugs which is going to suppress the immune system, there is no such absolute contraindication of having the vaccine. If I consider the risk benefit ratio, we would always say that you should have the vaccine first. But if we are taking the chemotherapy, we are taking the actively any kind of immune suppressing drug right now, so that time you have to consult your physician that you have to delay for 2 to 3 weeks for the vaccination, and then you have to get the vaccination after stoppage of the chemotherapy or stoppage of the any therapy or multiple sclerosis, the drugs for multiple sclerosis, like that. So you have to consult your hematologist once. So regarding the composition of the state of your disease, and I must say that the patients who are having the cancer in recent past, and after the completion of their chemotherapy courses, they are taking the vaccines, and to my practical knowledge, they are all taking, after having the vaccines, they will not get any kind of adverse reactions or any kind of problem. So we must say that it is safe, but how much efficacious the vaccine is for them, it is not very sure. because they are already immune suppressed, and the immune components of these persons will not respond good to the vaccine. It is the fact. So we have to, but we have to check the risk benefit ratio. So COVID is in these patients are more risky, is going to more vulnerable. So just get the vaccination whenever there is no kind of active disease or no such active drug intake, and that is for sure. And if we have any kind of doubt, or if you have any kind of immune suppressive drugs, or any kind of major drugs which is having a major side effects like that, so you have to consider your primary physician or your hematologist or your oncologist like that. So that, and after that you should decide on the vaccine. So Dr. Draupadi Ramnani is asking about, are steroids must for the treatment of COVID-19? Which is the best medicine to be given for COVID-19 positive cases? According to me, according to our national guideline and the different states guideline, if I consider, we have very comparative data. We have checked this, all the strategies, all the guidelines. Maybe it is from the institutional guideline. Maybe it is like the state guideline. If we consider whole, so there is no definite therapy of COVID-19 right now, but there is supportive treatment, and the main modality of the treatment is always the oxygen therapy. If we have any kind of, after COVID detection, if we have any kind of drop in the saturation, in gradual decrease in the oxygen saturation level in your blood, you must go for the admission, and after admission you should start the oxygenation. And for oxygenation you should have many we are many spectrum, like nasal cannula to BiPAP to the ventilation to the ECMO. So these are the wide range of oxygenation procedure or devices. So after being apart from that, we have very few medications which is a good role, which has a good role on restricting the disease or betterment of the patient, like steroids. And we have seen that after giving the steroids, the patients will respond quite good. And also the anticoagulation, if considering the D dimer and the coagulation profile and everything. So these two components is also very important for treatment purpose. And if we consider as a whole in one word, that what is more specific, what is more important, I would always say the oxygenation is the mainstay of treatment, along with the steroid, anticoagulations, and antiviral, whatever we have right now. If I consider that after oxygenation, how many patients are and also I must mention that do not try the steroids at home isolation patient, the patients who are not in a institutionalized or not admitted in a hospital. Do not try the steroids there, because steroids have some side effects, as well as you cannot monitor them properly, so that they could have some kinds of the increase in glucose level, like hyperglycemia, increase your infection, the chance of having secondary infection like that. So be specific on that. Get the patient admitted in a setup and then start the steroids. It will be better for them. Or otherwise, this very specific, and to be very precise, we have to monitor the patient on the oxygenation level, that is saturation SpO2. And if there is in maximum state, if I consider the maximum states, the guideline of maximum states on the national guideline, if it is below 95%, then there is quite good indication of having admission, of giving admit the patient. Please admit the patient if the saturation goes below 95%. And we see that if the saturation below 95%, and if you get the patient admitted in any setup, and if the treatment starts thereafter as soon as possible, then the chance of recovery is more, and the patients will recover very soon. The outcome of the patients will be very good. If it is our experience says, it is the guidelines says. And to the last, I have already mentioned all the questions. So just right now, I have to mention another thing. If I consider the disease progression or the disease itself, that the new strains or the second wave is coming with more various types of or more the wide spectrum of symptoms, like starting from dizziness, body ache, diarrhea, neurological components, cardiac components, like that. So previously we are saying we are emphasizing on only the fever, sore throat, anosmia, like that, and breathlessness. Now the components of the symptoms are wide open, and any system, the symptom related to any system, we have to consider this COVID once. And we are getting the more people, we are getting people with this no fever but severe body ache. We are getting the patients with diarrhea for 2 to 3 days with mild fever like 99 degree Fahrenheit or 99.6 degree Fahrenheit, and they are all going to get this. When the report is done, they are fine. We find that the COVID positive. So the spectrum of the symptoms has been changed, has been becomes wide, and so you have to consider each and every cases, and we have to take the proper history with the environment, with their the residents of where they are from, where they are coming, where there is a already case charges happening or not, like that. So consider all the symptoms at your mind, and go for the COVID test if you think so. If you think there is symptomatic cases, go for the COVID, because this is rising again, and the proper test, track, and treat policy should be implemented throughout the country to check the spread, to win over the COVID. Thank you.
Thank you so much, sir, for making an additional effort for our audience. I am sure we covered all the questions received. Thank you for your time. Also, on this note, I would like to inform you that we have organized another episode of COVID Chronicles, which shall be a panel discussion between Dr. Shashank Joshi and Dr. Ashok Gupta on double masking this Friday, 16th of April. You can find the link below in the description box. Do not miss out. Until then, happy Docplexing.